abdominal pelvic cavity here. So what you see right here is actually the superior surface of the diaphragm muscle right here. Consequently, here we have the inferior surface of the diaphragm as well. So immediately inferior to the diaphragm, all of these, this is just all the lobes of the liver, just as we would find in the torso model. Likewise, right here, all of this is the stomach. Over here, this thing that looks kind of like a tongue is actually the spleen. This is the spleen, this is the stomach. This big apron right here, this is what we call the greater omentum. The greater omentum covers the organs of the viscera. So if you ever had abdominal surgery, they have to work their way through this omentum to actually access the organs that are covered inferior to it. Likewise, you have to kind of work your way when we're talking about the heart, of course. Remember, I said in reality the heart is kind of oriented so that the right atrium and the right ventricle are much more anterior than, say, you would find the left auricle or the left atrium or the left ventricle. So this little component right here, this is my right atrium, this is my right ventricle, and we have to kind of pull this way back, and back here and almost posterior is where you find the left atrium and the left ventricle. So just removing the pericardial sac in and of itself can be kind of a consuming process. But once we've done that, we can actually identify the aortic arch right here. This is my aortic arch. As opposed to the human system where we find 3 vessels that originate at the aortic arch, on the cat we only have 2. We have a brachiocephalic artery and a left subclavian artery. That's the only 2 there are. See, if you look really closely right here, this is my brachiocephalic artery right here, and this one right here is my left subclavian. If you follow that left subclavian, you'll see right here it goes all the way on out, and it becomes the subclavian becomes the axillary, and the axillary becomes the brachial, and the brachial becomes the ulnar and the radial, just like we identified a few minutes ago. Let's go back to the brachiocephalic. The brachiocephalic actually branches 3 times about right here. This one right here actually continues up here on the left side of the neck. So this is my left common carotid, this is my right common carotid, and here is my right subclavian. 3 vessels that branch from the brachiocephalic of the cat. Likewise, it's easy to see that this major vessel here is your superior vena cava, orients toward the right atrium of the heart. So from here to here we have the superior vena cava. From here into here, this is my right brachiocephalic vein, and this is my left brachiocephalic vein. As it continues here, this is where we have the jugular vein, external jugular, and here we have an internal jugular. Internal jugular, external jugular, and they somewhat align or parallel the carotid that we can observe here. Likewise, we talked about the difference between arterial flow as opposed to venous flow. So here, this is my cephalic, this is my basilic, and this one here in the middle between the 2 is my brachial. And they continue on toward the, well, this would be the elbow really. So this would be your median cubital vein within that antecubital region. So that's pretty distinct right here. You can see that there's a lot of similarities in venous flow in humans as compared to venous flow in the cat. So if we remove, or at least shift, We can actually move the omentum. All of this is either, most of this is actually small intestine. In the cat, the large intestine is very short, only from about here to here, as opposed to about 5 feet in length in the human. But if we move this all back out of the way, just for reference, this is the urinary bladder. This vessel right here is the ureter that carried urine from this kidney to the bladder. If we begin with some of the more we call superior vessels, right here you can see we have a suprarenal vein. See how darkly blue it's stained? And it's leading to the adrenal gland right there. So this is the suprarenal vein, and this is the renal vein going to the kidney itself. Paralleling the renal vein right here, we have a renal artery. The renal artery attaches to the abdominal aorta just as it did in the torso model. So it'd be the same to the right as well as to the left side. This little vessel you see right here that's been sectioned, this is all that remains of my inferior mesenteric. I had to remove that so I could fold everything out of the way. Likewise, as we approach the terminal portion of the abdominal aorta right here, as well as over here, we have the common iliac arteries. This would be my left, this would be my right common iliac artery. Likewise, this internal segment here, this is my internal iliac arteries. As it continues on, it becomes my external iliac artery here, and then as it continues toward the back or hollow of the knee, it becomes my popliteal artery, femoral popliteal, just like we observed in the model. These didn't stain very well as we continued down the hind leg. Likewise, this big blue vessel here is your inferior vena cava. Off of the inferior vena cava, we can see once again the suprarenal vein, the renal vein here going to, and we have that same terminology used here as we note the bifurcation. So here we have a common iliac vein, left and right. We have an internal iliac vein, as well as an external iliac vein, a femoral vein, saphenous vein, popliteal vein, and so forth. For test purposes, generally I pick out big things like inferior vena cava, or abdominal aorta, or common iliac artery, or common iliac vein, something that should be readily apparent. Superior vena cava, brachiocephalic, left or right vein, something that should be like, I'm not going to put a pin way out here somewhere in this little vessel and ask you to identify it. So, if you want to put on gloves and probe or prod around on any of this, or if you just want to take pictures of it, or just whatever you want to do, you got basically an hour. If you want to take pictures of this, if you want